Hello everybody. In this video we are going to talk about cleft lip and cleft palate. In an earlier video I had already said that these are birth defects affecting the children, newborn children. Now when a child is born with a cleft lip or a cleft palate, the parents get very agitated. They get worried and they do not know what to do. So this is to reassure them that there is nothing to worry about and it is a completely correctable defect. It's a birth defect, yes, but it is completely correctable by means of plastic surgery. So those parents or parents to be must understand that there is nothing to worry about and it is completely correctable. Now, few children are born with either a cleft lip or a cleft palate. Now, the cleft lip can be either on one side or on both sides, unilateral or bilateral. It can be just a cleft lip or it can be just a cleft palate, or it can be a combined defect with the cleft lip and cleft palate, both, complete cleft. Now, the parents of the child will have a question in mind as to when do we get the defect corrected. Many hospitals and many surgeons, they correct it as soon as the child is born, within maybe 15 days or 2-3 weeks, they correct it. Yes, it can be done. But what are the advantages and what are the disadvantages? The advantage is that the scar will not be seen at all, it will not be visible. The disadvantage is that the muscle is ill developed, it is not developed fully, and a repair of the muscle is not done properly. So there will be still a functional defect. So what is the ideal time for a repair of a cleft lip? The ideal time for a repair of a cleft lip is 3 months of age. When the child is 3 months of age, the muscles of the lip are quite well developed so that the surgeon can join the muscle together and then repair the lip. Yes, the scar might be visible, but with the revision surgery or a scar revision, the scar can be removed and it can be made to be less visible. So the scar will not be a problem. But the function is the most important thing. At 3 months of age, when we repair the lip, the muscles are well developed, and when we anastomose or join the muscles together, the function of the lip is maximum. What is the function? The function of the lip is to vocalize. Air must not escape the lips when we are speaking. When the air escapes, it makes a whistling noise. So whenever there's a cleft lip repair that has been done, and when the muscle is not repaired properly, it results in a whistle deformity, and whenever the patient speaks, there's an escape of air causing a whistling noise, and that is not a good repair. It is not functional, 100% functional. So always we have to try to repair the muscle so that it gives a good function. Scar we can always repair or revise later. Now the second question is, when do we repair the cleft palate? The cleft palate cannot be done at the age of 3 months because the palatal muscles do not develop at 3 months. It takes a little more time, and the palatal muscles develop at about 11 months of age. And the child also starts speaking at about 11 or 12 months of age. So just before the child starts speaking, if we do the palatal muscle repair and repair the palate, then the child starts speaking normally, naturally. In some cases where the defect is too large, it might need an additional surgery in the form of a velopharyngeal flap, but that is a different topic in as such, and we will talk or deal with it later. This is to give the public in general a general outline about cleft lip and palate, when to do and how. All these parents can go to any good plastic surgeon or any good hospital and they can get the defect corrected. The cleft lip and cleft palate birth defect is entirely correctable by plastic surgical means. Thank you for watching this video. Thank you. We'll meet again. Thank you.